right, well, it's my distinct pleasure to introduce your president, Dr. Clay Catherine Burlew, the 69th president of the Southwestern Surgical Congress. You know, my father always said, you never know anyone till you go out and get drunk with them. I want to expand on that. You never know anyone until you get drunk and talk to their friends and family. So who is Clay? I called upon the list of people here. Many of you know are leaders at the Southwestern and have been long-term friends with Clay and, of course, her family. So who is Clay? Well, she's bright, intelligent, talented, academic. She's driven, determined, persistent, passionate. She is caring and selfless to her parents, her family, her friends, her patients. She's a great listener, acts positively, authentic. It's not about me, personable, with a sense of humor. And finally, they claim she's a problem solver and a role model. And as you know, she is legendary for her mentorship, particularly of women in academic surgery. So I thought we'd start and figure out how this all transpired. We have such a wonderful model for academic surgery. So I went to the most reliable source, her mother. And I had a nice conversation with her mother, and I said, well, tell me some stories about Clay. I can't wait. And she said, well, this will be a little disappointing because Clay was such a perfect child. I'm not certain I have any stories about her. She said, you know, if I was going to distill it down to one word, it'd be grit. And all of you know Angela Ducksworth's book on grit. This emanated from her TED lecture, which she was encouraged to write a book. It's not the original course concept of grit, but in essence, it's a book that emphasizes the power of passion and persistence, which her mother credits Clay with having. Well, where did our president come from? She was born in San Antonio, a purebred cowgirl, in the home of course, the Alamo, which may be symbolic of persistence, and the River Rock, a symbol of enjoying ourselves outside the hospital. Well, in the early days, her parents, Bill and Lauren Cawthorne, who fortunately are with us here today, provided a tremendous environment to raise Clay. And one of the early projects was to develop her smile. As you can see here, evolved nicely, and ultimately she's got that classic smile that's so disarming. At the same time, she was a purebred cowgirl. Well, her parents raised her in a culture of dedication to education and the fine arts. And you can see her father here trudging her off to early school, dressed up immaculately. And of course, she had introduction to all the cultural environments. Here's her as an aspiring ballerina. And here she is auditioning for acting, and clearly all of us would hire her if we saw her in this environment. Well, although there were many distracting events in her early life, when it really came down to asking her, what do you want to be, this captures it all. There was no question that Clay was destined for a profession in medicine. Well, acknowledging that, she, according to her grit, prepared well for this. She attended the St. Mary's Hall, in which remarkably 3 generations, grandmother and mother and her, have attended. She was involved in athletics, played basketball, and was the captain of the volleyball team. And ultimately, she finished St. Mary's in exemplary style, being a National Merit Finalist, the senior class president, and Cum Laude Honor Society. a common thread you'll see to her subsequent educational endeavors. Incidentally, during college, during high school and evolving into college, she had the time to be selected as the Princess of the Fiesta in San Antonio. Of course, many of you don't know of the Fiesta unless you're from that area, but in essence, it's a Mardi Gras of San Antonio. And she was chosen as the princess here, and you can see her riding through the streets of San Antonio, waving to all her fans. Interesting, this is a long-standing celebration. First started in 1891 in San Antonio as an annual event. Well, then Clay got a little more serious and headed off to college, and she decided she would sample the East Coast. So she went to Amherst College. There she continued her athletic prowess, and again, being captain of the volleyball team, and being a little bored, she thought she'd try a little hockey and developed her skills in defense, which she has subsequently used effectively. Interestingly, Clay did some basic science then. As you'll see here, she was the first author on this article. This is the first one, her CV, published on defining the pronucleus in the sea urchin egg. Maybe she'll give us a little more insight about that as we go along. But nonetheless, in style, Clay finished magna cum laude from Amherst College, quite an accomplishment. She could have gone anywhere in medical school with this record, but chose to return to Texas and attended the University of Texas Southwest Medical Center. There, in usual style, she was class president and founder of the Student Surgical Society. And I have to tell you a story. When Clay was still a resident, I was invited down to Dallas as a visiting professor, and I walked through this hall, and it was labeled Superstars of Southwest Medical. And there was the first picture of Clay, about 3 by 4 feet in size. And I came back and asked her, what was that all about? And this was how it happened. And she was, of course, AOA, and then ultimately, again, excelled, graduating #1 in her medical school class. Well, at that point, we were very fortunate in Colorado. Clay visited a number of places, but instantly bonded with our chairman, Dr. Alden Harkin. And all of you in the audience know why. Alden instantly recognized her talents and made a decision she could not refuse to proceed. So she did her surgical residency and then ensuing critical care fellowship at the University of Colorado and joined the faculty at Denver Health in 2002. She's had a number of very critical leadership roles at Denver Health in the interim, but now is currently and combined effectively the director of the Surgical Intensive Care Unit, the program director of Surgical Critical Care Fellowship, and the program director of Acute Care Surgery Fellowship. And all of you who have participated in this arena recognize that each of these is virtually a full-time job, but she does them all concurrently. She's also received citations for excellence in teaching from both our surgical residents as well as classes of medical students, awarding her the Outstanding Clinical Teacher of the Year. And finally, as I mentioned, she is known for her mentoring and has received the Excellence in Mentoring from the Academy of Medical Educators. And I must say, I have to recognize the importance she played in our university, both for peers, junior faculty, as well as fellows and residents. And as I always say, reflecting on this, you know, outside the operating room, the men go play games, the women solve the problems of the world. And Clay has shown these women how to survive in this very stressful environment. Well, I want to just briefly mention some of her academic achievements. Many of you know those in the room, but for those who aren't intimately familiar with the literature, I just want to go through quickly some of her tremendous accomplishments in the academic arena. She began in codifying blunt carotid intervertebral injuries, demonstrating injury patterns that warrant screening and the effective anticoagulation. But I think most notably recently, she has taken the charge of challenging the role of routine stenting in carotid injuries. And if you want to read about this, then you can go to Up to Date because she's the author of this area in Up to Date. Pre-peritoneal packing, Clay presented a nice summary this morning at our pre-conference on pelvic packing and has led the group in pioneering this, and most recently reported to the American Association of Surgery Trauma our 11-year cumulative experience documenting a mortality that is lower than reported in other contemporary series. And once again, you can go to Up to Date if you want more details. She's also been a leader in abdominal compartment syndrome, began to be, as really one of the first to talk about whether enteral feeding is feasible and advantageous in the abdominal compartment syndrome, and notably developed a technique that I'm sure many of you in the room have used that virtually achieved 100% closure with the open abdomen after trauma. She's also been a leader in emergency department thoracotomy, publishing many articles, and is the author of the chapter on emergency department thoracotomy for multiple editions of trauma. She also, based on all this experience and expertise in trauma, has also been, as many of you know, the author of the chapter in Schwartz's textbook for many recent editions. Finally, she's taken on the gauntlet for acute care surgery and has published on the scope of practice that we would like to achieve and how we may achieve that, and most recently has served as and continues to serve as the vice chairman of the SWSC Acute Care Surgery Committee, where she has personally developed thoracic and vascular training modules, emphasizing this as essential to the future training of acute care surgeons. What has she done for the Southwestern? She began serving on the membership committee, was chair from 2007 to 2010. She was program chairman in 2010, then served as secretary for 3 years, and during that period presented the Edward Poth Memorial Lecture on the abdominal compartment syndrome. She was vice president and then proceeded to president-elect, and during this time has also served as chair of the multi-center trials group. Well, I must say on a personal level, it's been delighted for me, it's been a delight for me to have Clay as a surgical partner. And as you can see illustrated here, I certainly needed the help. I've also been, had a pleasure of watching Clay develop her relationship with Paul, and I'm proud to say that she tells me this is the first picture of Paul and Clay was in our kitchen at a social event. And of course, if you run around with Clay, you get to rub shoulders with celebrities, and I always follow her around to know what's going on socially in the world. But what is special about Clay, I would be here to stand here to tell you that she is a model in maintaining priorities in life. At a time when professional burnout is literally epidemic, Clay rises above it all. She's been able to balance her work and family and friends into a very healthy environment. She's had clearly a commitment to her wonderful family, the Cawthorns and the Burlews. She's had a great relationship with Paul, and I'm always delighted to hear of all their travels and the fun things and see the pictures they have done. And finally, of course, her dream, Catherine Cupcake, right down here. One of her young lady, and I know Clay is raising her just like her parents had risen her into education, commitment, and culture, and young lady. So your president was born a Texan with grit. She had parents who raised her in a culture of commitment to education and the fine arts. She matured and excelled in all her educational venues. We were fortunate to have her come to Denver Health and the University of Colorado, where she has been a superb clinician that all who rely on her for her advice. She academically, unquestionably, is a leader in multiple areas and well-known internationally as well as nationally. And more importantly, she has had the time and made the commitment for her family and friends. And finally, I'm sure she is most proud, as I am, of Cupcake here in the front row. So with that, I'd like to invite Dr. Clay Cawthron-Ballou to the podium.